Welcome to the Value Script, the podcast where every episode brings value to the everyday person. Today we have a little more focus on our body and mind segment of our body, mind, soul, empire mission. And we have a very special guest, Dr. Brendan Mccarthy. Dr. Brendan McCarthy has been a founder and chief medical officer of Protea Medical. He's internationally recognized expert in hormone replacement therapy, a 3-time Ironman and hiker, and the author of this book, Jump Off the Mood Swing. Dr. McCarthy, welcome to the show.
Thank you. Thank you, Lonnie.
Absolutely.
It's a pleasure to be here. It really is.
It's a pleasure.
Looking forward to it. Yeah.
It's a pleasure to have you on.
Thank you.
We've spoken a lot on the podcast about, I think we've probably spoken too much about my midlife crisis and all of the caveats I brought into my life, excessive drinking, the stress, the relationship issues, and you're aware of most, all of these things really. And when I went to Dr. McCarthy, funny, I was able to trust him. Dr. McCarthy and I met socially before we met, as when I was a patient of his, and we were both in much different physical circumstances at that time. And I think really, you were dealing with something that I needed to deal with later. And so when I came to you, I knew I could be honest with you. And it was the first time in my life walking into any kind of a doctor's office, religious leader's office, whatever. I had no preconceived anxiety about the visit. I was like, I can go in there, I can be honest with Brendan, and I can tell him everything. And I think that was pivotal in the results that I'm getting, because I didn't hold anything back. I didn't hide anything from you. And you, not that you couldn't tell anyway, you got my blood work and all of a sudden you're like, I remember you walked in one day, you're like looking at me, you looked at my wife and you're like, you guys, I don't get you as a couple. You look like, you're more of an alpha and manly man, and she's more of a feminine girly girl, and none of your blood work supports the way you guys look. My testosterone had plummeted. It was horrible. And we have 2 years. I came in 2018, didn't fall through with anything, but we had the blood work to compare that to when I came in 2020. And I was still I'd actually gotten worse and unhealthier in 2020. And I'd had blood pressure.
Yeah.
I
remember that.
Almost 35% body fat.
I remember that.
Yeah. I mean, it's huge. You looked at me, you're like, after we made some changes, you were dying.
Yeah.
Slowly. And you helped me get on track. So once we started the podcast, I was like, we definitely have to have you guys on. So once again, thanks for being here.
Thank you.
But one thing that really touched Meredith and I too is we were looking at markers of our stress hormones in our blood. Right. And, you could look through our blood and be like, man, Lonnie, and you were like, you're so stressed out. And you looked me in the eye. And the first time we met with him, actually, you separated us in consults. You wanted us to be able to speak freely without having the pressure of husband and wife in front of each other. Like, what's going on? You genuinely cared. And I felt that you genuinely cared what was going on. And you not only not because you wanted to be nosy, but because you wanted to know how to help us best. And the first time in my life, I was able to walk out of the doctor's office feeling empowered that I could take control of my health. I wasn't going to be a victim of my body the rest of my life. I've dealt with allergy and asthma, and I was always the fat asthmatic kid with bad skin growing up. And so I just kind of feel like that's just kind of my lot in life. And for the first time, I felt empowered. I can take control of my body and take control of my life and have an advocate. I actually have a doctor I can trust who understands and who can help me. And if he can't do it, he knows who to send me to get those results. So that was phenomenal. What do you find? What do you find is one of the more common things that you come across and deal with in your clinical practice?
People like you.
Right. What does that mean though?
First I'd say it's humbling. It's humbling to be a person in a room with someone who's willing to share everything. It just is. And not everyone, I don't think it's a calling to be a physician. it's like it's a calling to be a teacher or a police officer. It's just calling to be these positions. And when it's your calling, you can do great work, I believe. And some people just do it for different reasons, but
financial quite often, right?
Yeah, and it's prestige and ego and those things.
Right.
But why I have that relationship with you and why I work hard at that relationship with my patients, because it's a constant, making sure that I'm present and I'm humble in that room, because it is humbling when someone shares with you at that depth. And what I feel like what it draws from me is my best self. Like when someone comes in and says, I'm this is me, this is it, and they just, there it is. There's no filter. This is all of me. This is what I'm going through. I can see on the lab work, you're right. But when someone opens up and just talks and they're willing to share and they're willing to show me these things they're so vulnerable about, it can't help but draw out. I want it always to. It doesn't always, I think, in medical settings, but it calls out the best part of you, and it should. And that's why when you have someone who's willing to be that vulnerable with you, you really need to put everything you have into that patient, all the capacity you have. You can't just phone it in. And a lot of times medicine is, you're in a tract infection, here's your script and you're out the door, but you want to be better than that. You want to be better than that. So the patients that I see that I've built around me over the years are, just people who are just the wear and tear of life is kind of tearing on them, breaking them down. There's certain things I really enjoy treating. That book is written, it's like a love letter to women, to just how much working with them has given me meaning to my life. So many times our brain chemistry is informed by our endocrine system, and our moods are informed by where our hormones are. We were speaking earlier about having anxiety. It even happens in men. So a lot of the patients that I see have irregularities with their endocrine system. Their hormones are completely off. We use lab work to verify this. Is not speculation. This is lab verifies, right. and there's no arguing it. And the research supports that. And so we have that. Then we have the other part of, which I know you talk about a lot, and you and I have talked about a lot too, just privately and in practice, the profound amount of stress that we live under and the impact that has also on our health. And that those combined, those are fertile fields to practice medicine.
Yeah. I really appreciated that when you walked in here too, the first real consultation we had, you were talking to me. It took at least an hour or 2 hours. I think it was two. You were in there for 2 hours, I think, with me. And I appreciated that you were willing to spend the time, because in the modern practice of medicine with, medical reimbursements the way they are, that people, if you're not seeing 40 patients a day, you're not paying your bills. Yeah, and it's hard to really, I think, get a full picture of what your patients need and really need. They've adapted the practice model to the reimbursement model, it seems. And I don't think that was really intended that way. But you have good people that are doctors that do practice this way. But for me, I appreciated the personal touch and the fact that I knew I had an advocate here, and I knew I had issues that I needed to address. Like, I didn't want to become diabetic, and I didn't want to be an alcoholic, and I didn't want to lose my wife, and I didn't want to, destroy, implode my life. But I knew I was headed towards all four of those things. And you, on every level, were like, "Hey, look at these liver enzymes. What are your goals with this? Like, you had a frank conversation.
Remember those numbers?
Yeah. I remember.
You're awesome. Call it for what it is. Your numbers are amazing.
Well, thank you. I appreciate it. No, they were bad. You're like, dude, you're headed for, they were so bad in one lab. The end of last year, the lab was so bad that you called me the second week of January just to see how I was doing. I don't know if you remember that. I was actually exercising when you called me, but you called just to check in and say, how are you doing it? And I was like, good. And he goes, no, really, how are you doing? And I was like, no, look, I haven't drank in 2 weeks. And you're like, how'd you quit? I was like, I just quit. I just cold turkey that. And you were like, then you cheered me on. Like, that's amazing. That's so great. And I was like, I started, that was when we started 75 hard. But my liver enzymes were so bad. You're like, look, in a year, and my C-reactive protein and other markers of inflammation were so high. You're like, you're headed for a stroke or a heart attack within a year. Is that what you want? I mean, you were like, is that straight up? Is that what you want? Because you're on the track for it. If you don't want that, we need to make some changes. What changes do you want to make? How do you want to make them? And I was like, and we talked about going on different medications and things. And I said, I think I can do it on my own. But if I can't, I'll call you and you were like, please do. But it meant so much to me, that personal touch of you calling me and being like, okay, what's up? How are you doing? And that helped encourage me. And then too, I thought it was funny last couple weeks ago when we were in for Emeritus Review, you mentioned about being on vacation. And you were gone for a little too long, you said.
Yeah, 10 days.
Yeah.
2 weeks, 2 work weeks.
Yeah.
10 working days I was away.
Yeah. And you said, I felt like I started to lose my purpose.
Yeah.
And that just made me think your purpose is your work and helping your patients and the way you care for them. And I just thought that was amazing. That like most people would love like, hey, I just got like 2 weeks vacation. It was awesome. I didn't have to go to work. It was amazing. And you're like, I started to feel like I was losing my purpose. I started actually getting depressed. Like that's how much you care about what you do. I don't know. It's one of the reasons I think you get the results you do. But
I use an analogy because other people think that sounds like a workaholic, and I know it could. Sure. But I don't bring work home. I rarely, if ever bring work home. I see patients 3 days a week. 1 day a week I do admin. Maybe another day I'll do admin work at the office. I'm home on the weekends. I don't bring home work, so I'm not a workaholic. But I think it was like a musician. I thought this was a good analogy. Like if you're a piano player and you love playing the piano, and then someone told you you're not allowed to play the piano for the next 2 weeks, after a while you get a little like, I miss the piano. I miss what I do. That brings me joy and happiness.
When you can you can create an impact, right? Yeah. It's beautiful. Another thing I love too is you were like, Lonnie, when you were looking at my numbers the first time, you're like, this is what this means. Right. And like, if you keep this up, this is what you can look forward to. Like, I'm not guessing. Like, I know, like we can prove that this is the track you're on. And you were like, look, I will never make an emotional plea for you to do anything with your life, to eat a certain way or not to eat a certain way, to live a certain way or not to live a certain way. You said, but I will use science and I will prove it with your own blood. I was like, that is putting your money where your mouth is as a physician. Like, I will prove to you the results you get by your own blood. And we'll use science, proven science methods to get there. And you were even so bold to say, and I guarantee your result.
It's true. Once you get rid of the cause of the problem, your body reflects it. And I mean, you're living, both of you living proof. Yeah. It's an easy guarantee to me because your body, once you remove those obstacles to being well, your body and yours is you're a perfect example. I think it was really touching. I don't think I'd seen you since last year because for whatever reason, I think I was we did
sick.
Some telemedicine.
I was sick at the last blood review, and then I hadn't seen you in 6 months or so. And so then when you saw me, just the look on your face, it made me
you look different. A couple of times I stopped look. Yeah. That's the reward of the job. You want to talk about like the reason why people get into this field. There's the people who are just monetizing being a doctor because there's money in the field. There is, I love the before and after. Yeah. I love the before and after. It's the most rewarding thing you'll have with a patient, in my opinion.
Well, and you got us on a little challenge now. Meredith's body fat's below mine now. So I was like, I'm coming for you, babe.
It's on.
I'm coming for you, babe.
It's good to have a challenge.
Right? Like that, because I was like, that shouldn't necessarily be the case. But it's amazing for her where she is. She's at an amazing level. Yeah. I need to get to an amazing level now. But I mean, it made a tremendous difference already. And I feel phenomenally better. Man, I'm stronger. I just feel better. I have more energy. I'm not depressed. It's
obvious.
We've made some big life changes and you were a huge part of that. So, again, I just am very grateful. One of the reasons we had to have you here. All right, so let's jump into this real quick. So on the last episode, our wives, phenomenal episode. If you guys haven't seen it.
I know.
Phenomenal. Phenomenal episode.
My wife's awesome. I love my wife. Your wife's amazing too, I guess, but I've never seen Celeste talk like that for that. It was really, that
was incredible. Yeah, but they brought up the topic of, drum roll. All right. Cheat meals.
Amazing.
Cheat meals. Let's hit this early. So
we had two different opinions.
So my thought on cheat meals is I appreciated how Celeste was like, if you're going to have a cheat meal, she did preface it, if you are going to, right? At least enjoy that time. Don't beat yourself up and punish yourself the whole time, right? But I think what I've always been told about cheat meals, I had a professional bodybuilding coach I hired a few years ago. I know everybody's gonna kind of laugh at that, but 2013 to 15, I got in really decent shape, and I had him. He was coaching me online, and one of his things was like, Lonnie, you can eat 3,000 calories a day, per meal, like per cheat meal. Mm-hmm. Like if you have a cheat meal and you go all out the way you want to go all out, it could be 3,000 to 4,000 calories. And that can throw off your entire calorie balance for the week. And that's why, you can be great for 20 meals of the week, but on the 21st meal, you blow it. Guess what? You didn't lose any weight that week.
No.
And your body composition didn't change. And that was all for having one cheat meal. Yeah. And, but if you have so that's a cheat. That's a cheat meal. That's a cheat, feast, right?
Yeah.
But if you have a cheat snack, might be a little different story every once in a while. But if you have a cheat snack all the time, that's going to add up, right? My little spoon of peanut butter every time I walk by the pantry. And peanut butter is pretty calorie dense, and that can end up sabotaging your diet. So what are your thoughts on cheat meals?
It's really nuanced. That's the thing of it, is that depends on what they're doing with that cheat meal. So, one of the things Celeste brought up is you're at a wedding and there are cupcakes there at the wedding. You want to be socially appropriate, have the cupcake. You're at someone's house, they made dinner. You want to be socially appropriate, eat the meal with them.
Yeah, we had some phenomenal tacos last night.
Yeah.
All out beans, rice.
You don't want to,
phenomenal.
Yeah. So you're going to be in those situations. This is what's culturally appropriate. This is what you do in those settings. With that said, most people, when they think of cheat meal, they're having an issue with food. Many of us have issues. Depends on what the cause of the cheat meal is. So if you have to be restraining yourself from, say, carbs, say milkshakes. Let's go back to last podcast. You say you're like a milkshake-aholic and you want to eat milkshakes, and I'm telling you can't do it. Your blood sugar's too high. Your insulin's through the roof. This is not a good thing for you. Triglycerides are high. We got to stop it. We got to stop it.
Depression.
Yeah, well, the thing about milk is that it has a couple things in there that are fine, but some of us not so fine.
Yeah,
Yeah, and so if you're sensitive to it, lactose is one. There's different proteins in there, casein being one of them, that are not always good. So some of them. So the reason why it's a comfort food. Let's go back to that. The reason why dairy is a comfort food and gluten, wheat is too, bread, is because they're exomorphs. That's the technical term. You Google that, but it's basically a food that has an opiate-like effect in your brain. Really? So when you consume it, there's going to be a little bit of a discharge of dopamine in the brain.
So it's like a reward in the brain.
That's a comfort to you. Anytime you get the dopamine, it's like, yay, that's good. That's how I comfort myself. So say that's yours. Yours is milkshakes, right? Dairy.
Absolutely.
That's your delivery system. You got sugar in there. You got plenty of casein in there. And it's delicious. I'm not going to lie. Milkshakes are delicious. So you're using that to stabilize your brain chemistry. And I'm telling you, it's killing you over here. You're getting diabetes. You're having these things. And it's not good. Or not killing you. But it's you're not going the right direction here.
Yeah.
So I want it out. So you're like, well, can I have a cheat meal once a week? It's like you're attracted to it to balance brain chemistry. So if you're doing it once a week, it's a slippery slope. How many people do you know say, I'm only going to have that thing once a week, and next time you talk to them, they're back on track eating it every day?
Yeah.
In practice, I never see it work. So when it comes to cheat meals, when you're in a social setting, you want to eat something to be appropriate in those settings, fine. But if we're doing something based upon your health and I want you healthier, there's no reason to. It's like having a cheat cigarette. I mean, what's the benefit of a cigarette?
Yeah.
Do you know what I mean?
So it seems like my brain is looking for more of that reward that I've been programming it.
Yeah, you're managing brain chemistry with food, which is so many books written about it. I mean, it's not even arguable anymore. When I first started practicing medicine, when I was first in med school, it was always these people saying, it doesn't do anything. Food has no, and the research is overwhelming. It's not even worth arguing with it.
Yeah.
So yeah, food does affect the brain.
Yeah.
How do you? Go ahead.
I was gonna say because I believe the gut has more transmitters
Serotonin.
To the brain.
Yeah, tons of serotonin in there.
Yeah. Wow. Okay.
Yeah.
So gut health, which I need to get on track.
Hey, so you want to talk about gut health?
But you're at the right age. I'm just jumping in. You're 30.
33.
Yeah, you're 33. You're great. I'm 53, right? So I have an AARP card.
Yeah.
That's where I'm at.
He was bragging about that off camera. He's like, check
That's
this
where
out,
I'm
bro.
at. I got my card. I roll in for my movie theater discounts.
Yes.
But there were times in my life in your age I wasn't healthy even at all. Bad. I look at photos back. It was bad. You're in a good place doing it now. You have so much time ahead of you to fix this. And it's like changing the course of a river. You can't make a right turn with a river, really. There's consequences. Yeah. But if you could take your health now and just start doing this, you have such a better
a slight curve.
Yeah,
gotcha.
Gentle. And then, over time, you're back to that where you're supposed to be.
Gotcha. Okay.
All right, this is a great spot. We've covered a lot of wonderful topics, and there is still so much I want to ask you, so much more I want to have you share your knowledge with our audience. And so we'll bring you back for another episode. But for now, we invite you to do the clickety-click. Like, share, subscribe. We'll see you again next time for part 2. Dr. Brendan McCarthy.